population of Cambridgeshire at the moment is a bit over 600,000, but 100,000 approximately are over 65, and in the next 10 years that's predicted to go up by 44%. So an organisation like Care Network, which aims to support older and vulnerable people, has really got an expanding market, you might say.
From a commissioning perspective, we know lots of detail about where the referrals are coming from, what the outcomes of the referrals are. It's not a one-hit wonder, there's the longer term impact.
What I like is the way we support not just individual older and vulnerable people, which we do, but we also support community groups like community car schemes.
We've got very little transport. They need to get to the shops, they need to get to the surgery, so to get them there, if we didn't have the scheme, they wouldn't get there.
We have the service called Help at Home.
It developed because we saw that a lot of people were ill at home as well as coming out of hospital.
I contacted Care and Home and they said they were going to come around and send a chap round to do my shopping for me, which I couldn't do when I come out of hospital.
It helps people in 3 ways. One, when they're discharged from hospital. The second, to avoid an admission, saving the NHS a lot of money. And the third way is by helping people do small tasks around the house that help them to remain independent at home.
It's lovely to be able to kind of go to bed in the evening and say, I've actually helped somebody in the world.
67% of those who'd referred people to Help at Home said that their patient was unlikely to remain independent at home without that service that we offered.
And the biggest thing is that people have helped me, so why shouldn't I help somebody else?
The Community Navigators are an initiative to enable people in the community, again, to access information that will be of help to them.
The biggest thing is meeting people, and that's the kick what I get in life. I found my niche now, this is it.
And we have an information officer who goes in and does a surgery. Once a week they do a morning or an afternoon in the doctor's surgery, and the surgery staff can refer people to them.
So instead of having all the time taken up in their surgeries with people who maybe have social problems rather than medical ones, the idea behind this is that we are there to signpost and help people so the GPs can refer them to us, and it's very easy for them to come and see us.
Because sometimes it's not just enough to give people a leaflet and say, well, there's a branch of the local Parkinson's group, or there's a lunch club, or you could go to the CAB for benefits advice. Sometimes people need that bit more support.
They're very innovative and they're good to work with. So from a commissioning side, they're a good organisation.
We hope to keep them, with their horizons broad and able to make a real contribution to their community.
We're gonna rock.